In this presentation, I'll be exploring word retrieval or word finding difficulties in aphasia. Aphasia results from an acquired damage to the left hemisphere of the brain. It is an impairment of input and output channels of verbal language, which means expressive and receptive language is affected, although severity may vary within each modality. It also affects all areas of language. Phonology, morphology, semantics, and syntax. Although language is not completely lost, it shows up in a reduced availability of words, reduced efficiency of words, where grammatical features are lost or overused, and reduced auditory retention span, meaning recall and repetition of words is reduced. It is also a primary language deficit, which means the primary problem is with words, and not secondary due to anything else that the aphasic is displaying, such as hearing loss or dementia. Anomia or word finding problems is a core deficit in aphasia. Word retrieval problems across different types of aphasia is further complicated by other symptoms such as fluency issues, auditory comprehension deficits, and poor repetition. These complications result in certain characteristics and behaviors, such as circumlocution, which is when someone has difficulty coming up with a word and they talk around it. Paragrammatism, which is when words are lost, and aphasic speaks fluently, but with more grammatical features than needed. Neologism, which is when an aphasic uses made-up words. Jargon, which is when fluent aphasic uses a string of made-up words. Perseveration is when correctly produced word is repeated after it is no longer relevant. Semantic feature analysis is a treatment that involves strengthening of lexical semantic connections, thereby improving word retrieval in patients with aphasia. In this type of treatment, the client is provided guidance to produce target word through semantic features, so by working through the semantic features. For example, if the target word was fish, you could use the semantic features group, use action, properties, location, and association to come to the word fish. So for group, you could say that it belongs to the group of animals. For use, you could say you could eat it. For action, you could say that it swims. For property, you could say that it has fins and it has scales. For location, you could say that it lives in the ocean. For association, you could say sushi or SeaWorld or aquarium. With this literature review, I wish to explore how effective semantic feature analysis treatment is in improving word retrieval difficulties, as well as generalization to improve discourse in patients with aphasia. The first study I looked at investigated the effect of this treatment on confrontational naming for trained and untrained exemplars. The researcher particularly wanted to explore whether using a larger number of stimuli promoted generalization more efficiently than using a smaller number of stimuli. The participant was a 52-year-old male with Broca's aphasia. The treatment involved 3 60-minute sessions per week for 16 sessions in 7 weeks. The treatment was used to help patients retrieve trained target words. Participant was guided orally and in writing. Incorrect responses were met by verbalization of the target word, repeated, and features reviewed. The results indicated that the treatment improved naming for treated and untreated pictures, but no generalization occurred for connected speech. Researchers also concluded that it was due to the participant internalizing prompts, although another study should be done to replicate the findings since only one subject was used. Also, the researcher thought that connected speech should also be looked at. It may yield positive results. The second study that I looked at involved more patients than the first. The researchers investigated whether generalization for untrained items and whether generalization for untrained items could occur, whether training effect is also maintained. 3 participants were used, 1 anomic aphasic and 2 with conduction aphasia. Treatment involved 36 pictured nouns that were incorrectly named before the treatment. And semantic cues were developed prior to the treatment for trained items. The participants was asked questions about the target, and 4 semantically related cues that were most meaningful to the patient were used for the treatment. And during training, those 4 self-generated cues were read out loud for trained items, and then participant was asked to name the target. Untrained items were also probed by asking the patient to name the target picture. 2 out of 3 patients improved in trained items as well as probed untrained items. But 1 patient did not show any improvements. Researchers concluded that the improvement was probably due to internalization of prompts, and generalization occurred only due to repeated probing. Performance was maintained for 1 week after therapy. The third study that I looked at it investigated the use of the treatment and connected speech during group aphasia therapy. The researchers hypothesized that it would improve word retrieval and enhance communication as well. Participants were a mixed group. 1 also had hearing issues and wore a BAHA. Another one had an atypical presentation of transcortical motor aphasia. He had auditory comprehension deficits. The participants met in a small group setting, 1.5 hours to 2 hours, twice a week for 7 weeks. The semantic feature analysis chart was modified to include a description of semantic features as well. Participants were guided in orally and in writing when they experienced problem in discourse with words. And upon making an error in absence of a response, the clinician provided cues in the form of a phonemic cue, verbal cue, repetition, reviewing of features to facilitate a response. Homework was also given biweekly to facilitate generalization. Results, 4 participants showed improvement during connected speech. They also displayed an increased rate of content production. Homework was, the rate of completion was low in patients with severe deficits. But overall, the treatment was beneficial. In conclusion, the use of semantic feature analysis in these studies demonstrate positive gains for fluent and non-fluent aphasics. More gains were noticed in mild to moderate aphasias and trained and untrained items. The approach can be used in group therapy as well, though more research is needed involving large, diverse group to substantiate the exact conditions under which specific aphasic population would make the most gains. And variables such as frequency of probing, generalization, individual versus group therapy can also be investigated and modified to improve treatment outcomes. Thank you.